Good evening. I would just like to take a second to welcome everybody out tonight. Thank you guys for coming, and we hope you get a lot from this. We've been really excited to put it on and really excited to be able to start sharing the information that we've gathered from patients and doctors, and together, if we can all be educated, then this is going to make it a lot easier of a lift for us to make real change here in Utah. So I'm just going to quickly introduce Brad Daw. He is going to be your moderator for tonight, and he is a former representative. So having him involved in this is actually really powerful. So again, thank you all for coming, and this is Brad Daw.
Cool. Thanks, Desiree. Appreciate that. And thank all of you for coming. It's always interesting to me when we have a forum and we're going to talk about, I don't know, kind of an unusual topic. And something I think is really important. But I just want to thank all of you for being here tonight. I think we have a really stellar panel, which I'm going to introduce. And we're going to make this a night of just trying to inform you of what's going on and where we're going to go. So without any further ado, because frankly you want to hear from them, not from me. So I'm just going to introduce them, and you almost are sitting in the right order, but that's okay. So we'll just start here. So I have Dr. Allison Fiducia. Oh, I got it right the first time. Okay. Holds a PhD. I should have brought my glasses. Holds a PhD in neuropharmacology and is highly published researcher in the field of psychedelics. She is the co-founder and CEO of Psychedelic Support, which works to connect mental health professionals with education resources, and a co-founder of Project New Day, a nonprofit that helps people overcome substance use addiction. She spent 5 years working for the Multidisciplinary Association for Psychedelic Studies and has participated in clinical trials investigating novel therapeutics for alcoholism. That's a lot of big words. Now, you're from Santa Cruz, too.
I live in Santa Cruz.
Now, do you surf?
A little bit.
Okay, all right. So you're actually almost perfect then. All right, you're awesome. All right, Eric Schwartz. Eric, raise your hand. Thank you. Was born and raised in Utah and is the youngest of 7 children. He served an LDS mission in Panama and earned his bachelor's degree in communication from the University of Utah. I'm sorry about that. Okay, I think I'm the only BYU alumni up here, but that's okay. All right, we love the Utes. All right. As a U.S. Air Force pilot, he served 5 tours in Iraq and Afghanistan. After a medical retirement from the military, he obtained a master's degree in Christian leadership from Grand Canyon University. As a patient, Eric has benefited significantly from psychotherapeutic medicine. He resides in Salem, Utah, and with his amazing wife, Melanie, and their 4 beautiful children. Is Melanie here? Oh, hi, Melanie. All right, Brittany Ferdner. Brittany is the one who got me into this whole thing. So if you like me, it's because of her, and if you don't like me, it's because of me. So anyway, Brittany Ferdner grew up in Oregon and earned her degree in nursing from that university. She is University of Utah. All right, okay, I'll quit it. She is a practicing nurse and health coach and enjoys helping people by treating the whole person. Brittany has found healing through psychedelics and now advocates for psychedelics to be legal and accessible for others because everyone deserves health and healing. Brittany is an avid marathoner and resides in Lehigh with her husband and 4 wonderful children. Dr. Reed Robinson is a psychiatrist, researcher, and social entrepreneur who currently serves as Chief Clinical Officer at Numinous. He was an early adopter of ketamine-assisted therapy and has led thousands of ketamine journeys. He is currently conducting an FDA-approved study of psilocybin for treating major depressive disorder. Born in Chicago, Reed Robinson grew up in Toronto, Canada. He attended BYU. Okay, there it is, another one, where he earned a degree in neuroscience and went to the University of Utah. Oh, I'm sorry. Okay, that's enough of that, Brad, now quit it. University of Utah, where he received his MD and MBA degrees. Dr. Robinson is an adjunct professor at both the University of Utah and Brigham Young University, and is the co-host of the podcast Psychedelic Therapy Frontiers. All right, and I'll just ask my panelists, is there anything you want to add to any of that? All right. Can I have a hand for these folks? This is a great audience we have here. All right. I want to tell just a little bit about my journey because I want to take just a second here because I want to focus most of our evening on the panel. But what got me into this is I was a former state legislator. I was reached out to by a dear friend who's here tonight, Nathan Frodsham, who's up there, and he said there's some real concerns about people who are active in the LDS faith using psychedelics. And through working through some channels and stuff, we got the impression that if it's legal and done in a medically appropriate way, it's okay. Well, it's not legal in the United States except for studies, but it is legal in other parts of the world. And long story short, because of their good influence and because I trusted them, I went to Arrhythmia in Costa Rica where they administer ayahuasca and had an amazing life-altering experience. And I can definitely see the profound benefit that psychedelics can have. And I will say that I spent a majority of my time in the legislature working towards the goal of ending substance abuse, substance addiction, and just seeing how hard people can struggle with that kind of an addiction. Nobody wants to be addicted, but there are so few legitimate ways to get them out of it. And everything I hear about psychedelics, my own personal experience is this is an avenue that definitely needs to be explored. That's it for me. We're going to the panel now. All right. So let's just start out really simple here. Let's see, is this first one? All right. We'll start out here, and you can have this is more for the doctors. What is a psychotherapeutic? Can you give some examples, and how do they work? That seems like a Dr. Robinson and maybe a Dr. Oh my gosh, Fiducia question. Dr. Robinson, why don't you go first?
I'll have to confess that I'm still adapting to the word psychotherapeutic. Psychotherapeutics, I think, while it fits, it's a broad encompassing term, like psychotherapeutic session, psychotherapeutic integration. But there is some charge around the word psychedelic. But you know, it's interesting. It was in a meeting, I think, like in the 1950s, a psychiatrist named Humphrey Osmond, the one who went to Aldous Huxley's house and gave him mescaline, and then he wrote Doors of Perception. He got up in this meeting and coined the term psychedelic, meaning to wander in the mind. And that was after Huxley tried to get him to call psychedelics something awkward to say, like phanerothime, something like that. And they had this poetry battle back and forth, and the psychiatrist won against Huxley, which was kind of cool. But psychotherapeutics is what we're using to encompass this idea of psychedelic-assisted psychotherapy, medication-assisted psychotherapy, these substances that have unfortunately been banned for way too long but are coming back with so much healing potential. And the medicine is just part of the equation, as we'll talk about. That really catalyzes, accelerates the therapeutic process. So there you have it. So anything to add, Allie?
Dr.
Sure, I'll
Fiducia,
give some
please.
examples. We have the classical psychedelics, which broadly describe substances that bind to the serotonin type 2A receptors. And examples of these are psilocybin, LSD, DMT.
Can you move your mic closer to you?
Sure. You may have heard some of these that create a shift in perception, visionary experiences. Another type are entactogens, which include substances like MDMA or MDA. These substances act quite differently in the brain and the body, and the experience can be profoundly different from psilocybin or LSD. It's more heart-opening, pro-social effects, less visionary experiences. Ketamine is another one that's classified as a psychedelic. At a certain dose threshold, someone can have a very significant shift in their consciousness. And that's just to say a few. Mescaline, ayahuasca that you described is a botanical preparation of different plants that traditionally comes from the Amazon basin, and cultures have been using it for thousands and thousands of years. But all of this is to say that it is important to understand that there's different pharmacologies and therefore different effects that we could expect, as well as different risk profiles, as well as we look at these different substances and talk about how we might use them as a therapeutic agent.
All right, and just out of curiosity, we don't have to answer if you don't want to. By show of hands, is there anybody in the audience who's had some experience with psychedelics? It's pretty close to unanimous. All right. All right, so we have an understanding crowd here. I'm going to back up to the previous question. I kind of suspected as much, but I thought, well, we ought to understand here. So, all right, today's World Mental Health Day. Among other holidays today. What is the state of mental health in America, and specifically right here in Utah? And again, we're going to get to the patients, but I'll ask the doctors again. Either one of you doctors have a good handle on that one? What's the state? What's the state in America and Utah of mental health?
So when I left BYU and went up to the University of Utah to do some more studies, I joined the faculty for a little while at the University of Utah. One of the first projects I worked on was the Utah suicide study, because Utah has been traditionally and tragically high up on the list of the top states where that's a serious concern. And but as we all know, the pandemic really put this magnifying glass on the state of our mental health collectively and individually in our community here in Utah and our families, where depression is the leading cause of disability worldwide. And that's a really rough condition to get, where, you know, one of the core symptoms, anhedonia, loss of pleasure in things, it kind of sucks the pleasure out of life and the hopelessness and everything that comes with it. So Utah has traditionally also ranked high in antidepressant use for a number of reasons. But I think we're right there with everywhere else in the country in realizing the state of mental health, and that it's a mental health crisis out there. But thankfully, with this psychedelic renaissance, I view it more as a mental health revolution. Like, there are these multiple things happening at once, where the stigma seems to be reducing, thankfully. It used to be taboo to talk about therapy or talk about your psychedelic experiences, but it's becoming more and more, instead of a sign of weakness, a sign of strength to go do your own work, go to therapy. But there's so much more work to do. The medicines we have aren't that effective. I leave so many people left suffering. So yeah, it's why I'm here for sure, is there's a mental health crisis among us, and we've got to do something about it.
All right, Dr. Fadush, I think there's another question that's kind of a follow-up, but I think I'll address this to you, and then if others want to take a crack at it. So I think we all agree the state of mental health in Utah and across the country is bleak, is maybe the best word to say it. It's tough. How would you say that psychotherapy, psychedelics, can address that? What can they bring to the table that we don't have right now?
So the psychedelic therapies that are under research right now in clinical trials are really a brand new paradigm. Instead of someone taking a medication continuously day after day to mitigate symptoms, the idea around this is that someone takes a psychedelic a few times in the context of therapy, with good preparation and screening, along with integration after. So with these altered states of consciousness, someone might have different perspectives about their mental health condition. When in the case of substance use disorder, oftentimes there's some other psychological issue or a past trauma. It's very common for someone to undergo a psychedelic therapy where they're able to access different emotions or really tune in to how they feel about different aspects of their life, whether that's past or present. And then with the help of therapists or their therapy providers, they can really start to take whatever comes up during these altered states and apply them to their everyday life. And I really see that this is a different treatment approach completely from how we typically just want to give something to alter the symptoms someone has instead of trying to get at the root problems of why do those symptoms manifest. You know, and when we think about psychedelic therapy as well, it's a whole new paradigm. Like ketamine, was the first FDA-approved medication with a new novel mechanism in over 30 years for treating depression. So in 1987, the first SSRI came out. So it's been decades since psychiatry or mental health practitioners have had new tools to work with. And it's really fascinating to me to think about the historical context of psychedelics, in that in the 50s and 60s, there was a lot of research that took place. And the findings were profound, as they are now, showing that many participants can achieve remission from symptoms or have long-term outcomes without the need for continuous dosing of medications. And so that's what gets me really excited about psychedelic therapies, is just the paradigm shift that they offer for treating health conditions.
Excellent, thank you. We're going to move to the patients now. Brittany and Eric, and Brittany, we'll go to you first. How did you first become involved with psychotherapeutics? Yeah.
Can I answer first on that last question?
Please.
You talked about? I just wanted to touch on, you know, the situation here in Utah, mental health. I look at it, the word mental health, not mental illness. I feel like this is a solution for mental health. And I, like myself, I don't have a clinical diagnosis of depression or anxiety, but I have been hit by a lot of life, like a lot of us have. And I feel like this is a tool that is so effective for dealing with life. You know, like you were talking about with the pandemic, when the pandemic hit, it's like you see people are fine, and all of a sudden there's like this like tipping of the iceberg, and you're like, oh my gosh, like we're not okay as a society, like mental health is an issue. But this tool, it is the most helpful tool I've ever encountered to deal with life. You know, like I don't have a clinical diagnosis, but I have a lot of stuff that's made me feel emotions, and it just is such a powerful way of taking you right to your root issue. And how you talked about how it's not like a treatment that you have to keep taking. Like my first time with ayahuasca, it literally carried me for like 6 to 7 months. Like one single experience with ayahuasca, I was carried, you know, like that. I didn't have to, anyway.
Perfect,
So
thank you. Well, that was basically what was your first experience with psychotherapeutics. You touched on it. Do you want to elaborate any more?
So my first experience, my first exposure to psychedelics was my husband, actually. We have a mixed faith marriage, and when he first mentioned psychedelics, I had that stereotype in my mind of what this was. I was like, you want to do what? Like, you want to do illegal drugs, and you want me to be okay with this? And he's like, just do the research, and just, if you're not okay with it, I won't do it. And that's where I started learning about all the Johns Hopkins studies, and everything was so positive. And soon after that, he went with my brother, my family member, not my brother, to Peru, to a place that was legal, and did ayahuasca. And this family member had some childhood trauma, some sexual abuse trauma. And when this family member came home, like he said that healed that layer of trauma completely. And I remember just being blown away. Like I still was not at a place where I needed it, but I was just telling everybody like this, like, oh my gosh, have you heard of this tool that does this? And a couple years later, I've been doing the healing work for years. It wasn't like this was my first exposure to taking care of myself and like trying to just maintain my mental health. And all of a sudden there was just stuff that I thought I had dealt with that surfaced, and all of a sudden it felt like I needed extra tools to support what was coming up. And my first experience was I went to Costa Rica, same place that Brad went. I went to Rhythmia, and it was a medically licensed facility, and that was intriguing. Like I liked that it was a place where I felt super safe, because when you're doing this kind of deep healing, you need to be somewhere where you feel safe. And it was one of the most healing experiences I've ever had. And what's so interesting about this healing modality is you think that you're dealing with this, and it's like, no, like this is actually what you need to look at. And it is the most powerful root healer I've ever encountered.
Thank you. Eric, same question to you. What was your first experience with psychotherapeutics?
Yeah, so my first experience, hot mic there. Okay, my first experience was just a couple of years ago. I'd kind of found myself, like probably many of us, right, living life and feeling kind of more disconnected from myself and from others. And some of that was past trauma, some of that was, being medically retired out of the military and losing that network and that environment of team, that environment of feeling part of something bigger than yourself. And I just kind of felt depressed, and to the point where, my wife would hear me crying myself to sleep. I just felt this overwhelming feeling of sadness and just disconnected. And I kept thinking, it's something that I can fix on my own. And that kind of man ego, kind of take control. I can do this. I can fix my thinking. I can fix the way my thought processes are going. And I couldn't. And I just kept finding deeper and deeper. And went and got on some SSRIs, and it kind of helped pull me up, but I was grazing my biscuits on the tree line. And I was very grateful for what they did for me, but there was kind of this process of diminishing returns. So the longer I was on it, it felt like I still had an infection that I wasn't treating, that I was covering it up, and that I felt like I was doing the right thing, but I just didn't feel like I was getting better. And my wife watched a video on YouTube, I believe, and she said, you may want to look into it. And I took psilocybin. And so I got Michael Pollan's book, How to Change Your Mind, and read that in a weekend, and felt very convinced that this was something that I wanted to do. So using my military experience, I went on some covert ops, and I didn't go to Peru. But, you got to do what you got to do. And I got enough to do, because I wanted to do 3 experiences, so I got enough to do 3 full-blown, what they call heroic dose experiences. And set aside a time, told my wife, I went into my bathroom, kind of created a safe place, and had my experience. And I mean, it delivered. I mean, how do you describe it? It takes you to the place where words can't describe. And it connects you to something that we all share in common. It connects you to this kind of the substrate of being that you feel connected all of a sudden and intrinsically worthy, right? Intrinsically important, intrinsically unique. And yet, at the same time, so cosmically unimportant. So it's this weird paradigm, but it was the one experience, and I came back, and the idea of anxiety seemed ludicrous. It was like I couldn't fathom what it felt. It was almost like I forgot what it felt like to wake up with that gut-wrenching anxiety. It was like something untied that knot, and it was like gone. And I was like, oh my goodness, where did it go? I'm so used to this. And it reset. So it's like it helped me reset my thinking, the way I perceived myself, the way I perceived others, the way I perceived my wife. All those things just became very, very aware to me, and I felt compassion. And I think one thing that I felt compassion for was myself. I felt a deep sense of self-respect, which I think that's where the healing starts, right? That deep sense of a feeling of worthiness, that's where it starts. Because once I feel that, then I can connect to other people. When I don't feel that about myself, I'm not going to reach out. I'm not going to be, I'm not going to want to engage with someone on that level. So anyway, that's kind of my story.
Can I add something?
You bet, but I just want to say, great answer. Thank you to our panelists. Yes, go ahead, Dr. Robinson.
Yeah, well, that's the first thing, is just thanking you both, because that's what it's all about. Your healing journeys. Thanks for sharing as well. And I just wanted to point out that as a psychiatrist who's prescribed a lot of SSRIs and now work with psychedelics, like the way you described it, the way you both did, I think is so telling, because there's a paper on it if anyone wants to read a little deeper called The Tale of Two Receptors, because SSRIs, of course, have serotonin in the name. They work on the serotonin system, but it's like the way they work, there are these serotonin 1A receptors in the limbic system mostly, and it's like you're putting your emotions in a cast for a time when you need to, but like you said with the infection analogy, it's not getting at the root cause. And sure, they have saved a lot of lives and been important for a lot of people at certain times, but it's also a tragedy that if that's all we have available. And so psychedelics, instead of this emotional blunting or putting things in a cast, they hitting this other receptor that's expressed all over, not just the limbic system. They create this emotional sensitivity, release, like Brittany said. And then with them comes this insight and flexibility, like you mentioned, like letting the brain communicate in new ways. Because what you described, I think, was also powerful about the hopelessness. Like when I work with people with depression, that's one of the hardest parts I see about it. When you're in a state of hopelessness, you feel like you're alone in it, and that you feel like it'll never get better. But that connectedness you felt and that compassion, like in a day, took away a lot of it, or in your series of dosing sessions. And that's what I'm excited about, is the ability to get in there, like Ali said, get to the root cause and not even need to give a daily pill. I mean, that's a beautiful path forward that we have with these medicines.
Thank you. And again, anytime, Dr. Robinson, any of you, if you want to insert or add, please do. Our whole point here is to inform this good audience here, so thank you for that. And just kind of my own question to the patients, but also the doctors. Some people might claim that psychedelics or whatever might dramatically change your personality, might alter who you are. How would you respond to that? Go ahead, Brittany, you first, if you don't mind. And then Eric.
I think if anything, it just like enhances. Like I feel like it's just, that's a good question to think about. I just feel like I love myself more. Like, you know, you just, like you were talking about the compassion piece, like you just have so much compassion. Like just this past July, I did a week of ayahuasca again, and there was one night where I just remember just having so much compassion, just being aware of like the things that like having that outside view of like the things that I've dealt with, you know, and just, it gives you a more accurate lens of reality. Because when you're in your victim mode and your trauma and your pain, you see things warped, you know, and once you start to heal, like you're able to see yourself and life and others from a more accurate lens. So if anything, I feel like it makes you more grounded and just more tolerant of others.
Eric?
Yeah, no, I would totally agree with that. And I think probably it is. I think you need to know what you're getting yourself into. I wouldn't willy-nilly get into these therapeutics and I think that's the value of having, I'm learning so much just listening to you. And that's what we need. We need education so cowboys like me aren't having to white knuckle it themselves, that we kind of can have some pre-therapy and post-therapy integration into that, because if one thing it does, it helps you be authentic. Okay, so what does that mean? That means some of my masks are going to come off. Okay, what does that mean? What does that mean going to work? You know, like things will change sometimes. And it's sometimes can be slightly disrupting. I remember people who probably knew me pre and post noticed a difference. And people who not liked me a certain way and liked maybe some of the ways in which I spoke and handled some things, they didn't like me anymore because I wasn't as, you know, down in the ditch, you know. And so you do need to, I think, understand that it does, but that's why we're coming to these, is because we're in a situation that we need help, right? We need help, and we're coming to these because we need change. We need to change our mind. We need to see each other differently. We need to perceive the world around us differently, We're not in a hostile environment, we're in a friendly environment. That changes the dynamics entirely. So do they change our personality? Yes, but I think, hallelujah, praise God, that they do, so.
Yeah, I can speak to a study I worked on for MDMA-assisted psychotherapy for treating post-traumatic stress disorder. And at the end of this trial, there was a personality assessment, and it was shown that these participants that responded well to the treatment had an increase in openness and a decrease in neuroticism, which are part of the big 5 personality traits. And so I don't necessarily think that you become a different person. It just strips away things that are hindering you from being open, or perhaps being neurotic, or tendencies you're using to cope in life with mental health challenges. So I don't see it that it creates a new person. It maybe just gives you a more higher state of operating, or your quality of life, to really bring out the personality that you have.
Can I say something?
Oh, please,
Past
of
experience.
course.
So this past July, when I did ayahuasca, it showed me one of the nights, one of my beliefs that I have about myself. It literally showed me where that belief came from and how big that belief was, that false belief that I've had. And all of a sudden it was like, oh my goodness, I understand why that hurts and why I act that way in that situation, and all of a sudden it's just like this awareness, and then you get to choose what you do with that. You can choose just to let it be this information that you do nothing with, or you can use it as like, oh, and then you use the integration tools and you can then work through it, and it becomes this path of deep healing. It becomes this way of life that it's you don't even realize you need healing until you start doing it, and you're like, oh my goodness, it's the coolest thing.
Can I add something?
Oh, of course, please.
Just want to join in the personality party here, because there's temperament that we're born with, right? And then personality that kind of gets layered on it over time, and like Allie pointed out, and like we're hearing in these real world examples, we do get more and more neuroticism layered on, or less mindfulness, less openness, more rigidity and closed-mindedness. So one thing, like my first ayahuasca experience, went down to the jungle, drank this strange medicine. They talk about nature connectedness, and sure enough, coming out of that, I couldn't even imagine just blindly harming the planet, or mindless consumption in the ways I did before. Or some of the food, if you don't want it to change how you view the planet or openness, or even the things you eat, all of a sudden I was like, wait, I can't put that strange thing in a strange package. I have no idea what it is in my body, for a while. And sure, you can numb that out and get back to default modes over time if you don't keep on practicing these paths. But another thing I wanted to point out is, the openness, the mindfulness, the nature connectedness, the human connectedness and empathy. If you look at a personality disorder like narcissistic personality disorder, it's an official diagnosis. The word narcissism comes from, if you trace it back, one of the roots is calloused, and what a callus comes from getting wounded. So you could almost swap it out for, that dude is a deeply wounded individual, not just a narcissistic individual. And if you can help heal the wounds, so we're not in this protective fight or flight mode ready to pounce on each other, then that can go a long way for humanity. So.
Great answers, thank you. This next question is more for the doctors, but if you other two want to weigh in. State of the research around psychedelics. Where is it at? Where are we going? And let me just kind of flavor it with, you're speaking to an audience here that's had some experience, and that's good, but want you to think about maybe the broader audience. Think of people who have never heard of it before, or who have heard of LSD from Cheech and Chong movies, okay? That's marijuana, but you know what I'm talking about, right? Give us the state of the research for people who may be a little less experienced, not unaware, where it's at and where we need to get to. Dr. Fiducia, why don't you go ahead?
Sure. We can start by taking a little trip back into time, because it's important to understand that LSD and psilocybin were studied in thousands of participants in the 50s and 60s for all types of conditions, including alcoholism, personality disorders, schizophrenia, all kinds of things. But it was really the political stance that came with the counterculture, the war on drugs. All of this ended research on psychedelics because there was no known medical use, and a high potential for abuse is the designation for Schedule I substances, which all of these compounds got placed into. And this designation of Schedule I prohibited research for so many decades that we're just now really getting going again with having rigorous controlled clinical trials to understand how to apply these treatments for different types of mental health conditions, and to really know who's this safe for. Every psychedelic substance won't be appropriate for everyone. And so where we are right now is MDMA, which is an entactogen-like compound. It's also known as ecstasy, and it's been used since the late 70s, early 80s in couples therapy before it really got out into the public and became known as a rave or club drug. But it has a lot of potential within psychotherapy because of its effects to help someone feel more comfortable in therapy, to feel like they can access traumatic memories or really dig deep into their emotional state without numbing emotions or feeling like they can't really connect to these memories. And so right now, MDMA-assisted psychotherapy for PTSD is furthest along with FDA. The second phase 3 trial was just completed, and it's expected that if the results are significant and replicate what was already shown in the earlier trials, that it could be approved by the FDA as early as 2023, and we might see it in the clinic in 2024. And with this model, it would be approved for PTSD specifically, and it includes a lot of psychotherapy to go along with the MDMA. Some of the other substances that are quite far along in the drug development process are psilocybin, which is the active ingredient in magic mushrooms. LSD is also in early clinical trials, and Reed could speak a little bit more to that one because he's working on a study that's testing this compound. But for psilocybin, some of the most advanced stage programs are for depression, treatment-resistant depression, major depressive disorder. It's also being looked at for alcohol use disorders, nicotine dependence. Some of the studies out of Johns Hopkins was phenomenal, showing an 80% abstinence rate at 6 months after psilocybin treatment for people trying to quit smoking. They received the first NIH grant in over 50 years to study a psychedelic for a therapeutic application, which is really exciting to see now our government funding being applied to research that's going to be trying to understand not just toxicity or abuse potential, but how could we use these as therapeutic tools. Ketamine, as I mentioned, a type of ketamine, S-ketamine, was approved a few years ago for treatment-resistant depression, as well as can be very effective for suicidal thinking. It's a fast-acting substance that can be delivered at various different doses and through different routes of administrations, along with psychotherapy too. I think it really has the most potential. But yeah, there's lots of different substances being studied, lots of new startups looking at substances we already knew about from the past, and also novel therapeutics, even some that are being studied that target the same receptors but don't induce the psychedelic experience. And it's arguable, like, is this a psychedelic? This is a novel compound doing something else, but it's really inspiring a lot of new research directions. So even understanding how our consciousness works, how we perceive the world, These types of studies are now underway with neuroimaging and modern technologies, so we can really look into the brain and the body and have a better idea of how might we apply psychedelics for a number of different health conditions.
Dr. Robinson.
Just a little slight tangent. Was anyone here in January 2020 when we had the Intermountain Psychedelic Symposium Scepter event? James Fadiman was sitting right here. Yeah, that was cool, and it's neat to look back on. So with some colleagues, we made this nonprofit Scepter and created this Intermountain Psychedelic Symposium event. James Fadiman is a pioneer in psilocybin microdosing, transpersonal therapy, like therapy that involves the spiritual realms and awareness of this therapeutic altered state. So that felt like a psychedelic coming out of the closet party for Utah back then. And since then, so last year, I finally got my Schedule I license to study psilocybin in Utah. Last week, we dosed and we did a psilocybin study with USONA earlier this year. We have one coming up with Compass Pathways. Last week, we dosed our first LSD study participant for generalized anxiety, first ever in Utah. So it might feel like slow progress, and there's a lot more to be done, and that's why we're all here, looking at these alternate pathways when so many people are suffering, or these other ways of looking at it, like Oregon has done with Measure 109, like Alberta just did last week, and legalizing some of these things. But for now, psychedelics are only accessible legally through studies, like these psilocybin trials for depression, smoking cessation. We were talking about the one for alcohol abuse. And MDMA is even trickier. There's not a site here in Utah yet, and there aren't countries where it's legal. But that's another way, is you can travel to places like Costa Rica, where you can legally, in a medically licensed facility, access ayahuasca and some therapeutic processes around it. You can go out of the country to get ibogaine for addiction. You can go to the Netherlands. You can go to Jamaica for psilocybin retreats. And there are even ayahuasca churches that have won in the Supreme Court the right to use these for their ceremonies. But that's the state of it for now, is more and more clinical trials, more and more access, a little bit of compassionate use where the government will let us give it in special cases. But yeah, we need to open up access sooner rather than later, that's for sure.
Thank you. Appreciate that. Next question, I want to preface a little bit, just briefly. Now, people ask if ibuprofen's safe. Well, the answer is yes, if you take the right dose. If you take too much, as these doctors well understand, and probably most of us know, really bad things can happen, right? So, yes and no. Is ibuprofen safe? Yes and no. The reason I want to preface that is, obviously the question is, you've talked a lot about some of the amazing benefits of psychedelics, and I don't think anybody questions any of that. What are the risks? What are the downsides? Are there some psychedelics that are safer than others? Are there some that you're more comfortable with? That's kind of a broad question. I'll let you kind of go where you want with it. But again, we'll start with the doctors for this one, and if the patients want to weigh in. Dr. Fiducia, please.
Sure. So we talk about psychedelics and safety. The most important thing to consider is the set and the setting. And this refers to the environment where you take a substance can really impact how you might feel, what might come up, and then potential safety risks that could come up as well. The set refers to the person's mindset. So it's known that if you go into an experience and you're having a lot of anxiety, you're at a festival, there's a lot of lights, that you could potentially have a really challenging bad trip. And so and that can lead to accidents or other things of harm. So when we talk about psychedelics, it's really important when we think about this is the mindset of the person and the environment where they're going to be taking a psychedelic. And the clinical trials are showing that there is very low toxicity with classical psychedelics, meaning that you probably couldn't take enough to actually reach a point of overdose. People also typically don't like to take psychedelics on a repeated basis, so therefore the potential for misuse or dependence is much lower. But as I mentioned in the beginning, we really have to consider the substance. Ketamine and Mdma have a different way of working in the body, and so we know that people that take ketamine ongoing in recreational contexts can have some really severe consequences from that on bladder toxicity in their brain. However, when giving in a medical supervised setting with limited doses, it can be very therapeutic. And this might be related to neuroplasticity and other factors. And so I really like to consider, the dosing, the frequency of dosing, and then where someone is going to be taking a psychedelic, and that's how you can really gauge risk. But there's a great paper out there that was published by Dr. David Nutt in 2010 that shows all the different substances, including alcohol, nicotine, on a spectrum of risk to oneself, to the others in their environment, to their health. And by far, in a way, alcohol and nicotine cause more harm, more serious illness and cause of death than psilocybin, LSD, and Mdma are way lower on the spectrum. So that's what I would share about the risk profiles of psychedelics.
It's really cool to be in a room with smart people. Thank you. Dr. Robinson, anything you'd like to add to that?
No, I think that David Nutt study is a great example. It was like lining them all up. And psilocybin won, the safest drug out there on all these measures. And David Nutt had since lost his post in the UK's Drug Council because of really publishing these solid results and saying, wait a second, we've maybe taken a wrong turn here in overscheduling, making these things so accessible. I think about the lives lost even when we could have had these healing tools sooner. But there are risks, certainly. I'll give you one example. There was a study done at Hopkins. It was a survey study. They asked several thousand people who had taken psilocybin on their own to talk about the experience. And the people had on average 5 or 10 of their own trips. And I think almost 40% said it was one of the top 5 most difficult experiences of their lives. Almost 10% went in to get some kind of treatment after. Maybe that was good. Maybe they got into therapy they needed, but maybe it was just whoa, that was crazy. And, or maybe they ended up in the ER. But of those, that same 2,000 person sample, 90% said it was extremely beneficial. A third said it was one of the top 5 most meaningful experiences of their lives. So when you look at the data coming out of these clinical trials, it seems pretty clear that the more of a mystical experience there is, the better the outcome and the more of an emotional breakthrough there is, especially when you pair those two. A high score on mystical experience, high score on emotional breakthrough, faced something difficult, made it through the other side. That's where there's even more lasting change. But that also means that it's hard to do on your own. It's not easy, and it can be scary, and there is screening to be done and risk assessment. But there are also beautiful healing stories from people who have done this brave work on their own because that's all they could access so far. So.
Yeah, I think we should also mention, illicit drug supply, so not from a medical facility. The risk of contamination is a real issue. Fentanyl is in all kinds of substances and can lead to fatalities. And so it is recommended that people use drug testing kits to understand what might be in a substance that they procure somewhere outside of a medical facility. And I also see this as such the reason why we need to have regulated legal access to psychedelics so that people don't have to rely on street sources that can be contaminated.
Thank you. And this is brief, and then we'll have kind of a question for the whole panel, if I could, just for the doctors, very briefly. You mentioned safety, and it sounds like pretty darn good, pretty safe. Are there conditions, symptoms, personality types, or whatever, where certain types of psychedelics may be, I'll use a fancy word here, contraindicated?
I'll let you start
Sure.
with that one.
So There are individual differences in the different psychedelics. Like if you're going to an ayahuasca retreat, they'll ask you if you're on an SSRI, or even scarier would be like some of the older antidepressants, because there's this potential for interactions. Or if you're going to do Ibogaine for addiction, they're going to make sure your heart is in good shape. But across psychedelics, there's a screening for like personal history of psychosis, mania, because there is the chance that like taking these medicines that can really shake things up might unearth something like that, or like precipitate an episode that might be bubbling up to the surface, and you got to be ready for that. So there's also, just like we've been talking about, the container around it, the psychological support, the safety, the suicidality that might come along with some of these really rough conditions that people are seeking treatment for, like depression and other things. But those are the main things that we'll look for, making sure someone's has their health relatively taken care of, although meaning we know what we're looking at in terms of blood pressure. If you need to get it in control, get it in control, because a lot of these might spike your blood pressure just a little bit during the experience, not more than exercise might, but still an important factor. And then screening for other mental health conditions that might show up, especially psychosis. Yeah.
Thank you. We'll move to our last question for the panel, and then we're going to go to the audience, give about 30 minutes for audience questions. So I'll just pose this, and we'll start with the patients this time, if I could, and then we'll move to the doctors. And I'll just kind of phrase it broadly and kind of let you take it where you want to. The fact is right now psychedelics are, other than Schedule I studies, illegal in the United States. And you come in here today, it's not risky per se, but it certainly puts you in a vulnerable position. Obviously, this is very important to you, or you wouldn't be here. So again, we'll start down there with Eric. Now that you're here and you've had your say, if you could have a magic wand and wave it around. By the way, when I was elected to the legislature, I kept waiting for them to issue me the magic wand. They never did. I don't know. Anyway, if you had a magic wand and could wave it, what would you like to see as far as psychedelics go in Utah and in the United States and in the world? Yeah. Okay, take a few minutes with that.
Yeah. I guess, I'm here representing probably all the middle-aged, overweight, 40-something-year-old men who kind of find themselves in that place.
Could you say 40 up so I could be in that group too? Just 40 up.
40 and up.
Thank you. All right.
You're included.
Thank you.
But I'm also representing all the veterans, and I read an interesting stat that broke my heart. Since 9/11, 125,000 veterans have committed suicide, and that's 22 a day on average. And I think we need to take a look at the problem. And I look at any risk that I'm taking, I'm gladly willing to throw my experience and my voice as one of, we need to re-look at these things. Basically because they work, and they work effectively, and they work quickly. And where if I'm a doctor and I get someone who comes to my office and I give them an SSRI, it takes 2 to 3 weeks for that to even start kicking into the system. And every day, 22 veterans, and that's just that cohort of people. And I'm just wondering, what would the world look like if people who found themselves in these deep, dark places of desperation, if they had access to this from competent medical professionals? That they could go, and it's destigmatized, where they can go and they can get treatment. Like, what would that do? What would that do for the numbers? And from my personal experience, I'm one that survived. I didn't make it there, and I'm thankful that I didn't. And hopefully we can make the changes that we need so that everyone who feels like they want to come have an experience with this medicine can. And do so in a safe environment, and knowing that they're being received into a community of people who understand them and who want to encourage them. Because it's the psychedelic experience is one thing. It's living in the light of that, as the day goes on. That's the hard part, right? But it gives you a new frame of reference. So when I'm having a hard day and you still have emotional upswings and downswings, you have a different point of reference to draw upon, right? I can go to those places that I visited in those experiences, and you draw on those, and it gives you resilience. It allows you to tap into that inner resilience and bounce back, instead of getting down there and staying down there, and then you can't get back out. So I think, I just want to be that voice for anybody who is suffering like I was, and especially all my veterans. I think we found something, boys, and I think that's exciting for the future. It's almost like, hey, we just discovered penicillin, That's a big deal, and we're on the edge of a new age, and I'm really excited. So I think we have a lot to be optimistic for, and I think we need to proceed with respect. We need to proceed with a lot of understanding and understanding how these medicines best interact with us. But super excited.
Thank you. Great answer. Brittany, please.
So I represent, like I said at the beginning, the person that doesn't have the clinical diagnosis, but I've had a lot of life that's hit me. And I know that is many of us. We have gone through a lot of stuff in life. And I just feel like this is one of the most helpful tools, like I said, I've ever encountered. I feel like I'm super passionate. If you follow me on social media, I'm super passionate about treating the root cause. What's the root? Why do you act the way you act? Why do you, why are you the way that you are? And the more aware you are of why you do what you do, you can change it if you choose to. And I just feel like this needs to, after you experience this healing modality, you want it to be available for not just the people that have money to go to a foreign country, not just the people that can do it locally and maybe there's some risks, but everybody. I recently had a friend whose wife went to Costa Rica to do ayahuasca, and she had some serious trauma, a lot of lifetime trauma. And one thing that I learned from her experience of doing this and coming back is how important the integration piece is. This healing modality is just a part of the healing experience. The other part is taking what comes up and how are you going to put that into your life? How are you, and most people, you can do that on your own and you'll be fine. But if you deal with someone that has trauma and they don't have the support, trained professionals with the expertise to take care of someone with trauma, you can actually do more harm for someone, cracking them open, I guess you could say. And this, I feel like I'm willing to put my name out there because this is a healing modality that works, and it's life-changing. And I don't say that lightly, and most of you have tried this, you know what I'm talking about. But it's to understand the root of the issue, it is life-changing. So,
Thank you. Before I get to the doctors, I just want to thank you. First I want to thank the patients. You're brave people. You're pioneers, and you're forging a new path. Doctors, you're staking your professional reputation on this. You've given this has become your life work. Obviously, this is very, very important to you. So again, that same magic wand. Where would you like us to go to? Dr. Robinson, we'll start with you.
So I would like anyone who needs it, who is suffering, to be able to come into clinic tomorrow and get a dose of psilocybin with the therapy they need for their depression or their addiction, or someone whose trauma we just can't help them through because it's too much, to come in and get MDMA and therapy. When I started my career, I would spend a day a week down the road at this beautiful nonprofit clinic called Utah Health and Human Rights, seeing torture victim refugees, human trafficking subjects. And we do not have the tools available, approved in psychiatry to deal with that kind of trauma, or the veterans. That's a powerful example But when you look at the MDMA results that have come out, the most recent ones are showing 67% coming in with severe PTSD that's been there for years, no longer even meet criteria for the diagnosis of PTSD after, and it lasts for months. So that would be my wish, to be able to give it to the people and open up access in an affordable, accessible way in a safe container. That's what I hope for. So.
Thank you. Dr. Fiducia, last word before we go to questions. Go ahead.
Sure. I hope for all the same things you do as well. And today is Indigenous Peoples Day, so I really wanted to bring up that a lot of these medicines that we've been talking about, psilocybin, ayahuasca, mescaline, ibogaine, have been used by traditional cultures for thousands of years, and we have benefited from the knowledge that they have shared with us. And so in the psychedelic field, it's a really important topic that we think about how we can give back to these communities and not just claim their knowledge in their culture and appropriate that in our own. And so when we talk about plant medicines like ayahuasca and peyote, they take 10 to 15 years to grow, and it takes a lot of ayahuasca vine to make a very small cup. And so as we get very enthusiastic, we also have to think about the conservation of the medicines and the medicine holders and the lineages that have been carrying these traditions for so long. And just wanted to mention that on this day, and I am hopeful that we will get it right and that we can have our medical supervised therapy and other ways of accessing these medicines and still be respectful and reciprocity to the cultures that came before us and gave us this knowledge.
Thank you very much. Let's go to audience questions, if I could. Now, I'm going to lay a couple of ground rules here. We have 2 mics here. We are being recorded, as you can see. We want to make sure that people who listen to this recording can hear your question as well as the answer. So if you have a question, please come to these mics, and we'll try to call on you in an orderly manner. If I could just ask, keep your question to the point, and then I will try to, if you have a particular panelist you want to send it to, go ahead and let me know, and we'll try to direct it to the right panelist. All right, please go ahead.
First of all, thank you so much for coming and giving your panel. I have hours worth of questions, but I think I can keep it to just 2. First, I'm an undergraduate at the U, and I'm trying to earn my degree in neuroscience or biology with an emphasis in neuroscience. And I'd like to ask particularly the doctors your advice on how I could get involved in early psychedelic research locally or somewhere in the upcoming years.
Well, I think that's Dr. Robinson. You're doing the research in the state. Why don't you go ahead and take that one?
Yeah, so as I mentioned earlier, it's not just a psychedelic revolution or renaissance. It's really a paradigm shift that's happening in mental health, and the train has left the station. They're coming to clinic and in other avenues too, decriminalization, legalization popping up. That's the other part of my wish I didn't mention, is I wish for anyone who wants to access these medicines for their own consciousness and spirituality to be able to do that without fear of hellfire, damnation, and the law, right? To answer your question, that's exciting going into this field. I'd say any field in neuroscience or mental health, whether it's therapy, nursing, prescribing, anything, once you're in there, you can shift your focus onto psychedelic medicine, psychedelic therapy in lots of different ways, and it's coming more and more. It'll become more and more widespread. But in the meantime, engaging with like psychedelic communities, societies, nonprofits, however you can, and I think we'll see more and more of those coming to Utah and elsewhere. Yeah.
There's a website, Psychedelic Grad, that you can check out, and then also MAPS maintains a email listserv for graduate students. So if you search for MAPS grad student listserv, you'll find it.
What's the website called?
The first one is called psychedelicgrad.com.
Psychedelic Grad.
Mm-hmm.
And is there one more quick question?
One quick question. We do have a lot of folks who want to ask questions, so we want to move it along, but go ahead.
I do have personal reasons I would want to take psychedelics, although I never have. Do you think that would compromise someone's ability to research those kinds of things in the future?
You know, it's an interesting question because even MAPS used to, through an IRB-approved protocol that's not as easy now for a lot of reasons, give people access to MDMA legally as a study volunteer as part of the training. When we train people in ketamine therapy, we have to figure out what's the right path to give someone an experience, because while it's not required to work with these medicines, it sure helps if you've had personal experience with the medicines, direct experience in these altered states, these therapeutic states of consciousness. So someone wanting to access psychedelics, all the disclaimers, the safety precautions apply, and the legal disclaimers too. But no, that doesn't compromise one's ability to study it. In fact, that's what opens a door for most people who go into this field. I know, ayahuasca blew the lid off my worldview and helped me reclaim even some lost spirituality I'd thrown out with the bathwater, you know, from growing up and navigating life. So.
Thank you. Over here.
So there was a lot of stuff about why does this manifest? I mean, coming back to spirituality, I'm a combat vet myself, so cool. I mean, Alan Watts talks about it in Zen, right? Why does it manifest? Because we feel that we need to fix our thoughts, right? As a Western man, we feel that our emotions are bad, and we need to fix them. But what psychedelics I've found, I've done LSD, I've done ketamine therapy at SLC Ketamine, which I highly recommend, Psilocybin, and I found that it helps you integrate your emotions and be safe to see them as emotions, as part of you. And again, that's all shadow integration is. That's what Carl Jung talks about. And so having that ability and that capacity to say, hey, I'm strong enough to see what's there. If you then decide to go back, you might fracture your mind because it's going to tell you a truth that you can't unsee. And then another scholar, I just want to point out, Brian Mirarescu, it's been on Joe Rogan's, been on Jordan Peterson. He talks about all the ancient cultures. He's gone and actually tested their chalices, finds, whether it be ergot, whether it be some sort of weird psilocybin with wine, weird psychedelic wines with 40 different compounds. So there's a lot of wonderful things out there. And I love that you've got the two, this is really more just comments, but I love what you guys are doing. I love that you have the amateurs and the scholars and the researchers. I've done research at the U as well. Love to be involved in any way I can. But ultimately, yeah, if you've got the chance to do it, it's a slide, a water slide. And you can claw your way to keep you from going down, but you're still going to go to the bottom. So you can either get to the bottom fine or rip off your fingernails. So.
All right, thank you. That sounds like just comments here. We'll move to a question over here. And my apologies to the cameraman. Hopefully it's okay. Go ahead.
So my question is this. It sounds like a lot of you are traveling out of country, particularly Latin America, to get these therapies. Are you at all concerned that at some point these governments are going to crack down or make these practices illegal?
I'm not sure that the legal stance will change, but as I mentioned, I think we all need to be mindful of the impact of a lot of tourists going to retreats and impacting culture and their environment in certain ways. And there are, I think, some retreats and places that do this better as far as conservation and awareness. But it seems like a lot of governments around the world are becoming more flexible or more open-minded towards psychedelics or other types of compounds that can shift consciousness. And I just wanted to mention too, for those that, this won't be appropriate for everyone, and to the gentleman that was just up here, holotropic breath work, there's no substance taken. This was developed by Stan Grof, who was an early pioneer of psychedelics. And it's a breathing technique that can get you into an altered state of consciousness in a similar way that a substance can. And so if it's legal, I do recommend that you find a practitioner or retreat to do this with as well, because it can have the same sort of unveiling of all your emotions and past memories and everything else. But there are legal options to alter your consciousness. in other ways.
I'm going to interject just a little bit on the breath work. I can vouch for that. It was actually pretty amazing. They do that down at Rhythmia. On the legal side, since it's a legal question, I might have a little bit of expertise on that. I can picture the committee meeting where they're thinking about outlawing ayahuasca in Costa Rica. Take Brittany, take Eric, multiply them by 1,000 of people who have been profoundly helped by Rhythmia and other centers in Costa Rica, to name one country. That is awfully tough for any legislature to ignore. And so as long as it's done responsibly, as has been mentioned by the doctors and the patients, I don't see any push to overturn it in countries where it's currently legal. Over here.
Hi, my question is about depression in general. A lot of what we're seeing is people are on SSRIs and SSNRIs, which are contraindications for MDMA, psilocybin. What are your recommendations for those people who are, or those patients who are trying to get off their antidepressants who want to try this therapy in a safe way in order to kind of wean off besides going directly to their doctor?
Yeah, it's a really good question because, and that last point too, not every doctor you go see will be friendly to this weird idea of exploring psychedelic therapy. There's more education, awareness to be done. And also, these aren't things that most people can't just stop immediately without some kind of, depressive episode or discontinuation symptoms. So what I'll do in working with people is look to some of the other medicines, like ketamine as a stepping stone to help someone lower and hopefully get off an antidepressant because it pairs well with lots of those. There are studies being done and work being done even in these retreats with psilocybin and antidepressants. For example, like an SSRI might interfere with the response a little bit, but some people are navigating that boldly and bravely, like Synthesis Institute in the Netherlands, one of the early reputable psilocybin retreat centers, working with Imperial College. How do we bring in people on antidepressants? MAPS did a study of MDMA and SSRIs showing how it can be navigated. The problem is in the stage we're in of tightly controlled clinical trials, that's the default answer. What the FDA requires is absolute clean sample of, but practically speaking, it can be navigated. There will be more and more people in the system and elsewhere with the tools and knowledge to help people navigate that. But, and there are some that pair well with a lot of medicines that we can use along the way. Yeah.
Okay,
There's
before you, go ahead, I'm sorry.
I was just going to say there's a lot of anecdotal evidence suggesting that microdosing psilocybin could be helpful for people trying to get off of SSRIs. It might be rebalancing the serotonergic system, but more research needed there. But it might be that these really low doses can give a bit of a mood boost and allow someone to really taper off the SSRIs for a lot easier and for longer periods.
All right, and before your question, just real quick, let's, if we could, just in the interest of time, limit our questions to those who are in line right now, if that's okay. And we'll just keep it brief. Go ahead.
Eric, I just want to say thank you for representing the veterans. There's another patient population that's dear to my heart. I have a son with special needs, and that patient population, the parents of these kids, can benefit greatly. I know that because I am one, and my perception of my reality, the existential crisis I went through when I received the diagnosis, and then having these entheogens to help me map out my future with my son was greatly helped. So the question is, what route would you guys suggest? Brad, maybe you can jump in here, being a state lobbyist. How can I represent these parents that could benefit so greatly?
I'll tell you that, or want me to tell you that? I'll take it from the representative side. Number one, keep track of the status of legislation. There is a bill in play this year to legalize for clinical use psilocybin. okay? Keep track of it. Watch where it's going. When it goes to committee, go and testify. When you testify, if you go much longer than 3 minutes, everybody on the committee is going to just go start looking at their email, okay? Keep it short to the point, but you have a compelling story. Don't be afraid to tell it. Anything else the audience would like to?
Yeah, well,
panel.
thank you for speaking up. One of my favorite things to do is to work with families dealing with a diagnosis, whether it's like, a severe mental health condition, special needs, a serious illness like cancer-related depression. And when people come to see us to get ketamine-assisted psychotherapy, for example, because that's the one legally we can work with in flexible ways, I'll often as I can, give the medicine to the parents as well, who are the caregivers and suffering stress and burnout. We even did, after the pandemic, we did a group pilot program of the wounded healers, anyone working on the front lines of the pandemic in healthcare, gave them ketamine and therapy, did it with Hannah and Steve in some of our Cedar Psychiatry clinics, and it was amazing. Like, the trauma scores reduce, resilience goes up, but yeah, I feel for you with what you're carrying, and I think these tools have such potential to help lighten the load of what we, like this collective and these individual things we carry through life. So yeah, thanks for advocating for that.
Thank you.
Thank you. Next up, please, sir.
Thank you. I just wanted to get your thought with those who may not need psychedelics for depression or anxiety, like Brittany, who may just want to better their lives with less anger, more love, accepting of those around them, just trying to become a better person, maybe more productive at work. How would you influence the Utah political environment to maybe keep psychedelics outside of, say, clinics and hospitals where the cost would be risen? I work in the pharmaceutical side of a health insurance company, and seeing how that healthcare influences with clinics and hospitals, that raises the cost of the care greatly. And for those who may not need it for depression or anxiety, but maybe want to better their lives, that may become a hindrance. So I was wondering what your thoughts maybe on how you might influence the political scene.
So I can jump in a little bit on that because it's a really good point. It's one of my big fears, to be honest, is the cost of these things after so much of a necessary investment in our healthcare system, is just how it works. Clinical trials take millions and millions of dollars to get something all the way to approval, then they're awarded patent protection and they recoup it by very high drug costs, and in this case you have a drug cost and all the therapy costs too. Thankfully, MAPS did a great cost-effectiveness analysis last year, published a study showing how for PTSD, even at the estimated cost of MDMA plus therapy, still going to save not only lives, but save dollars to the healthcare system. As more and more research comes out on psilocybin and gets out there to the public, people are accessing this in their own way, and more awareness and education and safety is a beautiful thing. And then there's decriminalization efforts, legalization in Oregon as an example. Even as I'm sure you saw, Biden last week changed the cannabis criminalization legislation. I know that's a federal thing. There's more work to be done on a state level, but the tides are certainly shifting, and we're seeing less and less people, thankfully, being punished for seeking tools for healing and growth. Yeah.
Thank you.
I too embrace many different models. I mean, there are already legal ayahuasca churches in the United States, the Santo Daime and the UDV. That's one model that's already legal. Native American Church with peyote. So for spiritual practices, it does seem like there could be other community-based programs or the ability for someone to explore their own consciousness at their home in a safe setting. So our website, Psychedelic Support, we put out a lot of resources for education around dosing, harm reduction, as well as continuing medical education courses to help medical professionals understand how to keep people safe if they come with questions.
Thank you. Next question, please.
All right, so I'm so glad you brought up cannabis. I wanted to also talk about that a little bit. I'm autistic, so cannabis is helpful for people like me with my condition. And I just wanted to let everybody know that cannabis is also a psychedelic. It's not as typically recognized for that attribute, but it is. And I just wanted to also mention that the 2018 Farm Bill legalized hemp. And since we have hemp-derived cannabinoids that were newly discovered, such as HHCP and THCP and CBDP, those are 30 times as powerful as regular THC and CBD. And I just wanted you to comment on how you feel about those substances being unregulated now and pretty much a free-for-all in all 50 states. And also, since I'm autistic, if you had anything to say about autism that might be helpful for me. And that's my question. Thanks.
Yeah, thanks for your question. The first ways I started working with cannabis was many years ago, prescribing it for kids with neurodevelopmental conditions and seizures. It was really hard to access at the time, like before the great legislation that has come through Utah. But there's this unexplored frontier of cannabis-assisted psychotherapy for things like healing trauma, somatic approaches to trauma. And now that it is prescribable, I'm a cannabis prescriber in the state of Utah, we can actually do that, whether it's in individual settings or group settings, even though it's in its infancy. Colorado has some people doing this, training in it. More research is being done. Even with the University of Utah, we're writing up a case report of cannabis-assisted therapy for trauma. But on the question of autism, there was a study of MDMA for social anxiety associated with autism that was really positive. There's someone who wrote a book on his personal experience with LSD and autism. Connect with me after. I can't remember the author's name, but I'd be happy to send it to you. But this is the beginning of a whole new understanding of the human mind, how it works, and what we might do. So I think there's a lot of potential there in the future. And as you can see, it's like a exponential effect as the trials have got off the ground since over the last 15 years. Now they're happening in nearly every state. And with the legislation in parallel, that's just going to expand even more rapidly.
And around the world, too, there's trials. Thank you. Next question, please. And thank you for sitting down with your foot there. We kept track of you.
Dr. Robinson, this is actually very specifically for you. As a person who suffers from several of the things that you guys mentioned tonight, I am curious if there's a way for someone like me to apply to your clinical trials and things like that. I would love to be a part of that, and how can I do that?
Yeah, happy to share. So we have a research clinic in Draper it's cedarclinicalresearch.com. And right across the parking lot from Cedar Psychiatry, where we work with therapy, meds, ketamine. But in clinic right now, as I mentioned, we have an LSD study for generalized anxiety going on. We just closed one for psilocybin for depression, but are opening one soon, psilocybin for treatment-resistant depression. And then lots more coming soon. So cedarclinicalresearch.com.
Okay, thank you so much.
All right, and just in interest of time, one sentence question, one sentence answer. Okay, go for it. Sorry.
Fun.
Yeah.
I was just going to say real briefly, my brother passed away about 6 weeks ago, and his wife works in the works in the medical field, so she did CPR for probably over 20 minutes. And this played out over about 3 days before he passed away, and they have 3 young kids. But she privately told me that she's doing ketamine treatments to help deal with this trauma, because she's got 3 kids to raise, and she has to work and do all that. So it's amazing that this could become more available to deal with crises, because sometimes you don't have time. But anyway, my question was very simply, I've never used any of these substances, but I've thought about it for years because of depression. If someone is new to this and they want to find a safe way to do it with the current legislation, I know that in Utah there's ketamine, there's studies you could sign up for. What other resources for someone that's brand new could try something like this in a safe way?
Brief answer. Who wants to give me a brief answer?
Anyone want to take that?
I can direct you to our website, psychedelic.support. We have free harm reduction courses, a free booklet where you can find out about dosing and risk factors and how to stay safe. There's also a directory of licensed health professionals that can help you before or after. They can't administer these substances, but there can be that support to help you access this on your own. And we're in Santa Cruz. I worked on the decrim. Grow gather gift, even though not legal, is a thing that can happen with psilocybin. That's much different than something like MDMA. Like, you're probably not going to be making that. So.
All right, last question. 1 sentence question, 1 sentence answer. Go ahead.
I did have 2, but I'll narrow it down to the 1.
Thank you. I appreciate that.
So, I'm going to be emotional. I apologize. With the patient who is more complex and has a lot of comorbid, heavy diagnoses that may not even be all present or diagnosed yet, but things like OCD, PTSD, DMDD, depression, borderline is being looked at, but the patient is 13. Is there any testing being done? Is there any use for these drugs in anyone under 18 that is safe? I know the brain is different when you're younger, and I'm curious if it's a possibility to have that sort of help. Your story resonated so well for my daughter, and I'm thinking of her and wanting solutions to offer her and get her out of where she's at.
All right. Resources for minors.
Yeah. I have 2 13-year-olds, and I feel for you with, it's as a parent, that's the biggest thing in the universe to help your kids. And the good news is with ketamine, we can use it down to younger ages. It can be used off-label. It's off-label for everything we use it for. So if you talk to someone who's experienced with it and works with teens, that is a possibility when there's a serious struggle going on. On the clinical trials, unfortunately, the kid studies follow after, teens and kids come after. Rick Doblin even mentioned something about the MAPS MDMA studies and the path to study it in teens with certain conditions after, but that's going to take some time. And seeking it internationally, you probably get a lot of the same walls, but there are things that can be done in therapy, and we can even petition the state to access things like cannabis at a younger age for some conditions too, and we've had success with that. Yeah.
Thank you very much. All right, in closing, just want to say a couple of things. First of all, I want to thank our sponsor, Libertas. Thank you for putting this on. This has been great. Thank you. All right, can I have a huge thank you for our panelists? They have been fabulous. And I'm sure there's going to be ways to get in touch with them if you have further follow-up questions and so forth. Thank you for your participation tonight. This has been terrific. Thank you. Have a good evening.